question.
All right, for the first one, I'm going to do the Thomas test. So I'm going to be testing the rectus femoris tightness and the iliopsoas tightness. Can you pick your leg up and pull it to your chest? So a positive finding would be the hip or the thigh coming off the table for the iliopsoas tightness. And for the rectus femoris tightness, would be her leg extending like that. All right. Okay, can you slide forward and lay on your stomach? Come over here. Okay, come this way a little bit more. So this is the Eli's test, I think is what it's called. So you flex the knee and you would check the hip for, or like feel for a reaction of the hip. Yeah. So there is movement, and that would be a positive finding. Or if the hip comes off the table, I think. All right. Can you lay on your back? Can you put both feet in the air without kicking the light? So this is 90 degrees, and then these 90, and can you extend this leg? So a positive finding would be, you can stop. A positive finding would be knee flexion greater than 20 degrees, and that's the 90-90 SLR test. And then the Tendelenburg's test, can you stand up for me? So if this was her injured leg, I think you lift the, you lift, so this is the injured leg, you would lift that leg for 10 seconds, and you would check if the pelvis dropped, then it would be a positive finding, and if it rotates up, then it would be a negative finding. Right here, okay. Can you lay on the table facing this side? And then for the piriformis syndrome test, I would have this leg be straight, back, a little bit back, and then this leg in 60 degrees, and I would hold here and push down on the knee. A positive finding would be tightness back here, and it tests the piriformis tightness. And then the Ganslin's test, I would have you lay on your back and come towards me. And then, okay, so this leg would be off the table. And then this would be flexed this way, and I put pressure both ways. And this is to test the SI joint dysfunction. Positive finding would be pain reproduction. And then the Faber test, maybe just move over this way more. Oh, this way more. And then put both knees down, and it'd be the figure 4 test. And so I'd put my hand in the opposite ASIS, and then I'd put pressure on the knee. A positive finding would be pain reproduction, and it's testing the SI joint. And then the thigh thrust test would be the knee is flexed in the 90 degrees, and I'd push perpendicular to the table, and a positive finding would be pain reproduction. And then the compression test, can I have you roll over facing me? This would be, I would push down here. A positive finding would be pain. And then can you lay on your back again? And then the distraction test, to spread the ASIS, positive finding would be pain again. And then the hip scoring test, I would take this leg, and I would push down while putting an external rotation and adduction, and then internal rotation and abduction. Positive finding would be pain reproduction. The FADDIR test, so it'd be almost similar. So the leg would be a 90-degree flexion internal rotation and adduction. Positive finding would be pain reproduction. And then it would be, positive finding would be groin pain, and it tests the hip, it would be testing for hip impingement syndrome. All right.